Welcome to the JTV Caribbean News. I am Sean Rose. Heads of state and government representatives of countries that make up the Regional Integration Bloc Bolivarian Alliance for the Peoples of our Americas Treaty of Commerce for the Peoples, ALBA TCP, gathered in Cuba on October 20 to address a joint contribution to the prevention and fight against Ebola. The summit, according to Cuba's official daily Granma, was held to coordinate Ebola fighting activities in West Africa and the presentation in Latin America and the Caribbean. ALBA includes Venezuela, Cuba, Nicaragua, Ecuador, Antigua and Barbuda, St. Lucia, St. Vincent and the Grenadines, and Dominica. St. Lucia's Prime Minister Dr. Kenny Anthony and St. Vincent and the Grenadines Prime Minister Dr. Ralph Gonsalves addressed the summit.
I do not know what in this region,
que no conozco,
and indeed in this world,
que en esta región
what we would have done with Cuba at a time like this.
Realmente en este mundo habremos hecho sin Cuba en este momento.
I have read the draft declaration.
He leído el proyecto de declaración y debo decir
it's an excellent document.
Que es un documento excelente donde se plantean las medidas, prácticas y los principios que deben guiarnos. San Vicente y las Granadinas espera que esta declaración sea aprobada unánimemente y podamos continuar con el trabajo.
The meeting was also attended by the director of PAHO, Carissa Etienne. PAHO discussed how to strengthen regional efforts in order to prevent the disease from spreading throughout Latin America and the Caribbean. 12 Latin American and Caribbean countries then agreed to tighten border checks to stop Ebola from spreading to the region and draft an action plan to deal with the epidemic. Financial losses, major management issues, and bad debt plague key Cayman Islands government authorities. In his latest report, Cayman Islands Auditor General highlights weaknesses in the business models of some statutory authorities and says change needs to be swift in coming. The Cayman Islands Auditor General, Alistair Swabrick, questioned the civil servant's competency to get the job done. He says as a result of these inefficiencies, there is $1 billion unaccounted for between 2011 and 2012 in 2 ministries alone. Mr. Swabrick also says 10 government authorities reported a deficit for that time, with at least 6 of them under significant financial strains and unable to meet their obligations.
This has and will continue to be the case in most instances without changes in operations, business restructuring, or continuing government support. For a number of others, whilst not having immediate challenges in meeting their obligations, there are warning signs of potential future challenges if action is not taken to address them in the short to medium term.
The Auditor General pointed to a number of authorities in his report, including Civil Aviation, the Airports Authority, the Health Services Authority, the Turtle Farm, and Cayman Airways. The Turks and Caicos Islands Court of Appeal Monday granted permission for several government ministers, including former Premier Michael Missick, to take their concerns to the London-based Privy Council. The former ministers, who are facing allegations of corruption allegedly committed during Missick's tenure as head of government, had challenged the impartiality and independence of Jamaican Judge Paul Harrison, who was selected to hear the case in the TCI. The accused are also arguing whether their rights to a fair trial are being infringed by Justice Harrison. According to Caribbean 360, there have been questions as to whether the Jamaican-born jurist would be independent or impartial because of the terms and conditions under which he was hired. Harrison was appointed as the judge for the corruption trials during the interim administration when London imposed direct rule on the British Dependent Territory and following a probe by a one-man commission. St. Lucia's Ministry of Health met with healthcare unions to discuss how to protect public and healthcare workers in the eventuality of Ebola in St. Lucia. Healthcare professionals continue to call for requisite training and the acquisition of medical gear. The St. Lucia government says it's taking steps to address the concerns and welcome the input of practitioners. Winston Springer Jr. of HTS News Force has this report.
The Permanent Secretary in the Ministry of Health is hailing an Ebola Steering Committee meeting with health-related unions a success. Officials sat down with the St. Lucia Medical and Dental Association, the Fire Service Association, and the Police Welfare Association, as well as representatives from local labs, for deliberations on the island's Ebola response plans. During the sit-down, the ministry invited recommendations from the professionals on tackling the issue. Concerns about training for frontline healthcare workers and staff who would have limited contact with patients in the eventuality of a case here was foremost on the agenda.
We also spoke very clearly about some of the options that would be available and to the staff. For now, we are pursuing all options to protect the staff in terms of what it is, the protective equipment that they would be empowered with, the necessary information that they would be empowered with to be able to make the right decisions at the right times. So it was a very good meeting.
Another sticking point for healthcare professionals is the provision of the up-to-date protective gear and the required training and protocols. The president of the St. Lucia Medical and Dental Association, who welcomed the exchange of ideas on dealing with the threat, continued to stress the need for the procurement of the correct attire and fine-tuning plans.
Well, in different meetings, we have brought to the fore that the protective gear that was once recommended by the CDC is probably not ideal. Being a surgeon, being in the medical field, I mean, that was pretty easy to discover. There are portions of the body that are exposed. The ministry is on board with us, have recognized that protection of the healthcare workers is essential. I mean, we're not talking about immigration, etc., where the patients probably are not yet symptomatic. We're talking about a patient who is contagious.
The association has also echoed the sentiments of former Chief Medical Officer Dr. Stephen King, who last week called for a designated isolation and quarantine facility far removed from public health centers like main hospitals.
It makes no sense trying to isolate a patient in a general healthcare facility, which is going to expose patients and healthcare workers unnecessarily to Ebola. And first and foremost, we have requested and will continue to request that an isolation facility be designated so that if there is a suspect case, that we all are on board and know where that person needs to go.
Moreover, the Medical and Dental Association suggests isolation areas for the healthcare professionals charged with treating probable Ebola patients. The respective unions and associations are expected to present position papers with recommendations on best practices and measures to the authorities. Winston Springer Jr., HDS News Force.
The Board of Control for Cricket in India, the BCCI, says it will initiate legal proceedings against the West Indies Cricket Board, the WICB, over its players' decision to suddenly abandon the Indian tour. The BCCI Working Committee has also decided to suspend all bilateral tours to West Indies in response to the visitors pulling out over a pay dispute with the West Indies Players Association. India were expected to travel to the West Indies 4 times in the next 8 years. The BCCI press release made no specific mention of any claim for damages, but reports suggest that the BCCI suffered a loss of up to $65 million as a result of the West Indies pullout. The West Indies followed through with threats to quit the tour after the 4th one-day international in Dharamsala, with 1 more ODI and the 2020 and the 3 tests remaining. The West Indies players pulled out, claiming that the West Indies Players Association signed a collective bargaining agreement and the Memorandum of Understanding last month without its knowledge and consent, and has pressed WIPA President Wavell Hines to resign. Hines has refused, and the board has said it will honor the CBA and the memorandum. That's it for the JTV Caribbean News. I am Sean Rose.
And coming up next on JTV News. Government continues with plans to manage the impact of Ebola should it reach the BVI. Dr. Mitchell Penn speaks to JTV News about the current chikungunya outbreak and dismisses suggestions that the virus is not being spread by mosquitoes. And U.S. Virgin Islands delegate to Congress Donna Christensen says they have a plan to avoid the hassle for BVI artists entering the USVI.